Welcome back to Studio 701. We're going to get it together here, folks. Every October, we are reminded, once again, Jeff and I are both wearing pink because it's October, it's Breast Cancer Awareness Month, and it's also a great time to remind yourself to get checked and check in with your breast health.
Now, Dr. Schaefer McLean joins us now. Thank you so much for being here. We really appreciate it.
It's really great to be here. Thanks again.
Have you had a fluffernutter before?
I haven't. I was opposed because of the marshmallow. It's not my favorite. But you guys, all the stars. I'm going to have to try it with the kids tonight.
It was actually really good.
Way better than I was expecting. Now, Dr. Rhonda, do you recommend everyone do self-examinations, and how often do you recommend that?
We've actually moved away from recommending that we do regular monthly breast exams just because what we were finding is that there was a really high number of folks who were getting more and more need to return to clinic, need for biopsy, and it was turning out to be benign. And so what we recommend now is breast awareness, so that we're aware of breasts and changes in dimpling, redness, nipple height actually even, and whether or not we feel something that is a new lump or bump, but not specifically because we're asking patients to do breast exams themselves at home.
And so a question I've been thinking about the last couple of days when I knew you were coming on was, how about men? Can men do self-examinations?
Obviously, I mean, anybody can do the self-examination. What we know for men is that when men get a breast cancer, it tends to be something that is typically genetically linked, because it's very rare for men to get breast cancer. And so when they do, it is oftentimes a genetic red flag that there may be a gene in their family that's abnormal. Certainly not wrong for any of us to be more aware of any parts of ourself or our person. But you know, I guess we'd have to get maybe a family medicine doc or an internist to answer that question a little better. I mean, my focus is just women, Jeff, so I don't know the technical answer of what the you know, regularity of that could be.
Sure, fair enough.
If you do find a lump, it doesn't necessarily mean that you do have cancer. You gave us a list of 3 things that it potentially could be. Let's go through those right now.
Sure. Oftentimes we will have breast cysts, and that's just a fluid-filled little sac. We can have a fibroadenoma, which is kind of a rubbery little bump, and those are okay, and they may be up to even about 1 centimeter in size, or even a bit larger. And then just tissue changes, specifically in women that have had augmentation or reduction or any kind of a biopsy. You'll see some of those tissue changes or just tissue ridges that are native to, you know, the woman and the breast that she has. And so learning the difference between those is really helpful, because otherwise it's oftentimes alarming for women when they palpate and they feel, you know, something different than the remainder of the tissue of the breast.
Now, you can have, if you do find a lump or something, you can have a mammogram, an MRI, or an ultrasound.
Correct.
And how do doctors decide kind of what's best for each patient?
Absolutely. So first of all, we do a screening mammogram. We typically do those every year or every other year, depending upon the preference of the patient and the kind of intensity of screening to which the doctor subscribes. And then there's a diagnostic mammogram, which is, hey, we think we might feel a lump or a bump or something different here, so we're going to send for a specific focused mammogram on that breast and that space. And then we use MRI actually more and more and in more different kind of ways and modalities than we did before. So we can have screening mammograms for folks that are high risk, like those genetic folks or folks with a lot of breast cancer in their family, even if they don't have a gene. And we can oftentimes use spot compressions. We can use ultrasound if the breast is particularly more dense and younger. And so those are really some items that oftentimes the prescribing doc and the radiologist will visit about to decide for subsequent imaging.
Okay, and let's recap real quick to go over 3 tips for the best breast health, starting with monthly self-awareness. You gave us this list here, Dr. Rhonda.
Yeah, monthly self-awareness is just a great idea. Take a look in front of the mirror, raise your hands above your head, make sure you don't perceive any new lumps, bumps, or anything that is different. Get a routine mammogram. Discuss that with your doc. Decide if you're a once a year kind of gal or a once every other year kind of gal. The balance of that is, if you go every year, you get a little bit more lifetime radiation. If you go every other year, we may miss something in the off years. And then check for genetic risk factors. If you've got 4 aunties that have had breast cancer, or or, you know, a dad that had a breast cancer. These are concerning items. If you have someone with a young breast cancer in your family, we really want to be thinking about, do you have a gene? Because that changes the screening that we can offer you and the screening that's covered by insurance.
Wow, some really great informative information. Dr. Rhonda Schaefer-McLean, thank you so much for being here. This has been Wellbeing.
And for more information, you can reach Dr. Rhonda at Balance Medical or UND Center for Family Medicine. Now, keep it here. We are going to continue talking about breast health awareness this month, and specifically about